we're talking about the risk of athletes. Um, Basically, right now, the big conversation is all around kids going back to school, and that obviously involves student athletes and athletes in college who make a lot of money for colleges and universities, but they don't get paid themselves like professional athletes.
Mhm.
So, in your medical assessment, as of right now, and I get that this is fluid, what's the risk of kids going back to school and playing contact sports?
We're going to take on increased risk with having more children back together, but we as a society have to make a decision of how much risk we're willing to take with regards to these children. With regards to sports, kids need to be active. And one of the ways that they're active is through organized sports. And so many children have fallen behind with their activity levels, with their education levels through this COVID crisis. And at some point, we're going to have to open up.
Do you think that this is all being a little bit over dramatized? I mean, 160,000 Americans have died from this virus. So it is certainly the most serious pandemic we've all dealt with in our lifetimes here in this country. But kids, for example, a high schooler, a young, healthy high schooler playing football, right now, all the research, not some of the research, all the research points toward them being the least susceptible to having a serious case of coronavirus. Isn't that accurate? Doesn't that need to be out there?
The risk to children with regards to coronavirus is very low. And part of the reason why we're doing a lot of this is to try and protect the rest of the population. But unfortunately, the children have been left behind. They're the ones that have sat at home on iPads. They're the ones that are sitting on computers and not getting out and getting active. And I worry a lot about their mental state, but also their physical state when we don't have the ability for them to interact with other people and for them to play sports.
Yeah, I think there's this theory that there's going to be this magic bullet vaccine late 2020, early 2021. Unfortunately, it just doesn't work like that. No matter
Mhm.
what the politicians say, we know from previous pandemics it doesn't work like that, or previous vaccines. So at some point, kids have to get back out and play sports. Would you say there are precautions that need to be taken, or sports that are absolutely off the list, like a contact sport, like maybe football or hockey or something like that?
I think that all sports can be played. They just need to be played with some separate mitigating efforts. And one of those has got to be to protect the older people that are around those children. So coaches need to keep a 6-foot distance. Coaches need to be wearing masks. And then we need to be doing these things outside as much as possible and keeping kids separated as much as possible. But when you're talking about some of the sports, contact sports in particular, there's going to have to be some face-to-face interaction. But in practices, we can limit that.
So what's the concern with an elementary aged kid playing a sport, going home, picking up the virus, and then infecting, mom, grandma, grandpa, that sort of thing?
Most of the children that we are finding that are COVID positive are being found incidentally. They are asymptomatic and they're being tested because somebody in their family was sick, or they're being tested because they came into hospitals with another complaint and the hospital's admitting the patient and then checking them for COVID and finding out that they have it. So most of these kids are asymptomatic. So if they're asymptomatic and they go home and they have a grandma taking care of them or a great grandma in the home, they could get that person sick.
So they definitely could still infect somebody, even though they are asymptomatic.
If you're COVID positive, you can potentially spread that virus. We don't really know for sure, but we believe that that's the case. So that's a lot of the meaning behind why we've kept children away. But we've done this now for 5 months, and we have to get children out and get them active in
Yeah.
capacity.
Is the answer just better, more available rapid testing for student athletes? I'm thinking high school. I played baseball and hockey in high school, and I couldn't imagine not being able to play, especially if I was a junior or senior and upperclassman. These are the years you look forward to really your entire young life. What if we had rapid testing? These kids could get tested, boom, they can go out and play. It's not a big deal. We're just not there yet, are we?
The problem with rapid testing is, yes, rapid testing would tell you if someone has it, but once you've been in contact with someone with COVID, you could have COVID in your body for a period of time before you show symptoms. And that's where we're going to run into this big problem with opening schools, is if a child with COVID shows up and exposes my child, then my child has to sit out for 14 days. You can't test around that. We can't test them and say they don't have to stay at home for 14 days. And that's where we're going to run into the biggest problem with the opening of schools and the opening of sports.
As a doctor, this better than anybody. We're imperfect. This is never going to be. There's never going to be this magical solution to this problem. Kids have to play sports. Do you think that kids should be back this fall, this August in our state, playing sports and being active outside with their friends?
Rob, as a sports medicine physician, I'm advocating for kids to get active and get playing. As a father, all three of my children are playing sports right now, and all of them are going back to school in person.
Um, there has been some research. I was just reading it before we came on this morning about, and now I'm talking about the older kids, particularly
Mhm.
high school and those college athletes. And we're in Florida. I mean, we love our college football, particularly our college football, but all our college sports are affected, at least in the fall. That student athletes can have coronavirus can leave people with long-term heart ailments. Is that something that's giving you guys pause? And the only reason I ask is because the information when it comes to coronavirus from the CDC, the World Health Organization, it's fluid, so it's constantly changing and updating. Could this be something that we really need to, this could be the canary in the coal mine right now. We don't need kids having long-term heart issues because they played football at Florida State.
We don't know enough about myocarditis with coronavirus, but what we do know is that most viruses or many viruses can cause mild inflammation of the heart. And we have not seen a huge jump in the past 5 months of kids coming into the hospital with myocarditis related issues. So this is probably in line with what other viruses do, but we just don't know yet. I don't think that risk should keep kids off the field.
As you connect with your colleagues, is there anything that student athletes should be doing that are just practical? I mean, do you think that are your three kids wearing masks as they play their sports?
So I think the most important thing to do is that any time where you don't need to be together, to spread people out. So if you take a knee after practice, have people be social distance. When you're waiting in line for a drill, be social distanced. You don't need use a dummy rather than having them tackle other kids. These are the simple things that we can do to space children out. The other things is that they should be wearing a mask to and from the field so that they're not interacting in large groups. Just because you don't have to wear a mask on the field doesn't mean you should be wearing a mask when you leave the field. And I think most importantly, coaches need to be wearing masks because they're at a higher risk. Children under the age of 18 are at a very low risk of having complications associated with coronavirus. So the biggest problem for them is if they're spreading it to older people.
I have young kids, so they're not really involved in sports yet. What are your kids' coaches doing right now to protect themselves and their families as well?
There are mitigation efforts. So my children that are swimming, they're having their own lane while they're swimming in the pool. They're swimming on opposite ends. So one group will start 1, 3, 5, 7 will start on one end of the pool, while 2, 4, 6, 8 will start on the other end of the pool. My son who's playing football right now, we're doing social distancing. So the kids are staying socially distanced. The coaches are always wearing masks.
Mm-hmm.
I mean, we're trying to keep the kids apart as much as possible, but that's a sport that is outdoors. Now we have not gotten to wearing pads yet and having that direct contact. But I will tell you that the children are benefiting from being out and being with others and getting active. Many of the kids that I've coached really were undertrained when they arrived. They'd been sitting around for 5 months. And I think that unfortunately, that's what a lot of children have. And we're going to end up with other medical problems with these children if we can't get them out and get them active.
How long do you foresee this being an issue? Do you think it gets into spring sports, winter sports? Do you think we're talking about this next fall?
I think that if we don't have therapeutics that come online, we're probably going to be running through this at least through the end of the year, at least till next summer, unless the coronavirus changes. So it's the way we approach activity with the children. And if we can't play organized sports, or if you're a family if your family is worried about playing organized sports, then you still need to get your child active. Kids have got to get out and get moving, because what I've noticed is with e-learning and the availability of being able to be sedentary, children just aren't getting out and getting active, and they need this exercise, especially at this important part of their life.
It was interesting as this started in March. We pulled our daughter out of school. The school's all closed down. For the first couple of weeks, you're like, well, maybe this is kind of fun and it's like an adventure. We can all kind of get through this, and we'll see how bad it gets. And then now we're entering month 6 now. We're approaching month 6. Kids can start to develop really bad habits and things that can carry over long term when it comes to eating. They're all this kind of stuff. 6 months, a lot of time if you're 3, 4, 5, 7, 8 years old.
I think that children, in America, we've become comfortable with our children sitting at home on couches, looking at devices all day long.
Right.
And that's something that if you would have asked yourself a year ago, if you would allow your child to do what many of us are allowing our children to do right now, you wouldn't. So one of the ways we do that is by getting some organized sport activity or some organized activity for these children to get them outside and to get them active again.
So, Doc, what we have a lot of parents that watch our morning show. If you had one message for parents that are concerned about, we got to get the kids back to school. That's going to happen. Kids are going to go back, whether it's virtual or not to start. Kids will be back in school. What would you say to parents about your comfort level with kids playing sports?
I think that every family has to make a decision on their own. It's a family decision of whether you let your children play sports. But if you don't let your children play sports, you still have to find a way for them to become active, because we're going to be limiting some of the PE in schools and some of the recess time. So you're going to have to find a time for them to be active outside of school. Physical activity is very important for them. And if we don't get our children active again, we're going to be dealing with long-term medical problems down the road associated with obesity and the sedentary lifestyle that children have had over the last 5
Mm,
months.
mm. Doc, great stuff. Thank you so much.